Welcome to the Kashi Clinical Laboratories webinar training video on understanding and interpreting the Defy Your DNA program test results. This presentation is an overview of the Kashi Clinical Laboratories Defy Your DNA program report. The presentation will cover many important details, including the numerous medical SNPs tested for in the program, how the results are displayed, and how to utilize this program to maximize the benefits to the patient. At Kashi Clinical Laboratories, we are led by Dr. Kashi, who is a brilliant, dedicated, and respected scientist. She has worked hard to create an excellent facility that you as a provider can trust. Kashi Clinical Laboratories is a fully accredited laboratory in all 50 states, including New York, California, and Florida. We also provide services internationally. The Defy Your DNA panel was designed to give the practitioners a comprehensive look at their patient's genetic health. Within the report, the provider can find information about the test results of some of the most medically relevant SNPs, recommended treatment considerations to optimize wellness, preventative measures to ensure health, and helpful additional information designed by the Kashi Clinical Health staff, physicians, and scientists. One frequently asked question is, when should a provider order the Defy Your DNA panel? Genetic testing can be clinically beneficial in many situations. Some examples are a family history of certain medical conditions that may be genetic, medical conditions that do not respond to treatment, abnormal disease presentations, laboratory results showing signs of nutritional deficiencies, to help build a strong preventative treatment plan, to gain a better sense of understanding of their patient's unique biochemistry, and to help validate their patient's health concerns. Medically relevant genes are grouped together so that the practitioner can easily see a patient's overall increased risk for disease in a specific area. Important genes that are related to weight management include FTO, MC4R, FABP2, ADRB2, and SH2B1. These genes control appetite regulation, response to exercise, carbohydrate metabolism, and fat absorption. Important genetic markers of the cardiovascular system are called 9p21, AGT, ENOS, or NOS3, MTHFR, ApoE, and SLCO1B1. Each of these markers are involved with the development of cardiovascular disease that affects the health of arteries, blood pressure, inflammation, drug metabolism, and lipid and/or cholesterol levels. Several genes have been linked to certain vitamin and nutrient deficiencies. These genes include BCMO1, FUT2-1, and several important vitamin D genes, MTHFR and TMPRSS6. Depending on the allele that the patient carries, they may or may not need to increase or change their form or dose of nutrient supplementation. Certain genes have been found to be linked to prominent conditions seen in aging population. Genes like WNT16, ESR1 and 2, COMT, CYP1A1, and MAOA. These genes relate to bone mineral density, estrogen metabolism, and the estrogen's impact on bone turnover. Many practitioners working with hormone replacement therapies utilize these genes to inform treatment decision making. The methylation cycle is a key step in the recycling of homocysteine, the production of nitric oxide, methionine, SAMe, and the regeneration of B12. Important genes tested for in this panel are ENOS, MTHFR, CBS, MTR, and MTRR. All SNP results are displayed clearly and concisely on the second page of the Defy Your DNA program report. This will help the practitioner to quickly and efficiently interpret all of their patients' test results in a glance. Genetic markers are organized according to health systems, allowing the practitioner to identify important genetic correlations within these groups. In this example, the results of the weight management section are displayed using symbols to indicate if the patient's genotype is homozygous or heterozygous for the risk allele, or if they do not possess the risk allele at all. This will allow the practitioner to quickly put together the associations related to the patient's genotype. In addition to genetic test results being displayed concisely, the following pages will relay the patient's test results in a more detailed manner, allowing the practitioner to better elaborate to the patient what their genetic or genotype means. Each test result that is displayed will be followed by an explanation about what the gene encodes for and how that product affects the body. The top section lists each gene and the association of each of these genes. The results are repopulated for easy viewing. We recognize that many practitioners need more than results. You're looking for guidance. The test report contains 2 paragraphs for each genotypical section, one on treatment considerations and the other called additional comments. Some of the information will be familiar to you, particularly the comments section. There is considerable value to the patient in seeing a lab report reinforcing the same message that you have been sharing. Finally, on the last page of the Defy Your DNA report, there will be additional groups of genetic test results that are paired together in order to help the practitioner identify areas of concern. For example, several genes tested for have also been found to be associated with an increased risk of diabetes. These associations are reported on this final page along with the specific patient's test results so that the practitioner can easily identify potential risk. One of the biggest advantages to genetic testing with Kashi Health is our fast, easy, and painless sample collection kits. All that is required from the patient is a quick cheek swab that can be performed in the office. This testing method is great for patients that are afraid of needles, hard to draw blood from, or for the younger population. The first step to getting started is signing up as a provider at kashihealth.com. After you have done that, you can request test kits and get started testing. After you have received your first sample report, you will receive a free consultation with a clinical consultant such as myself. The numerous advantages to using Kashi Health as your testing laboratory include non-invasive cheek swab, fast test results, all testing is done in-house, we are accredited in all 50 states and internationally, we have comprehensive, easy-to-read reports, HIPAA-compliant electronic reporting, and return shipping included. Another important advantage to testing with Kashi is that each SNP chosen for testing has met our rigorous standards for research and supporting evidence. This means that Kashi's genetic test panels are very clinically relevant. Clinical consultants such as a staff physician are offered for free to help ordering practitioners feel comfortable interpreting and treating their patients based on test results. In addition to checking out the website for further resources, please feel free to contact the Kashi Health Account Manager, Vivian, directly, or you can sign up for an account with the Kashi Clinical Laboratory website at www.kashilab.com using the Become a Provider button. Thank you for your interest in the Defy Your DNA program. Call us today to set up your account and order kits. kits.